Welcome back. This is Responding Positively to Behaviors. In this part, we are going to talk about tips to avoiding agitation. How can we notice when our elderly parents are getting agitated? What can we do to change that situation? And what happens when agitation gets so bad that we can't manage it? Stay with me. We're going to go through the normal housekeeping and then move forward. So as you know, I use the term elderly parent or elderly parents. Substitute that term with spouse, husband, wife, anybody who you are caring for. The outline for this module is in the course materials. Please do print the slide handouts, make notes, follow along. The ellipses in the slide, all of the dots are purposeful, as you know by now. Let's talk about the objectives of tips to avoid agitation. At the end of tips to avoid agitation, you should be able to recite how declines in physical and cognitive ability and difficulty communicating result in behaviors of agitation. You should also be able to identify how to adjust interactions and communications to produce a stable environment to reduce behaviors in agitation. And in the event that none of this works, we'll talk about options. The progression of physical and memory declines are part of Alzheimer's and dementia. As memory loss progresses, communication skills decline. Physical abilities will also decline to the degree that the person was physically active or not before the diagnosis. In my personal experience, it seems that one aspect or the other takes priority. What I have seen is that persons who were very physically active, they remain active, but memory loss accelerates, and the opposite. If multiple chronic health issues were present, memory loss may progress more slowly and the individual may be more aware of the situation. Either way, both situations result in stress for family members who watch these changes in their loved ones. Verbally stating feelings of pain, hunger, thirst, being tired, or depressed becomes less common. There is less recognition about declines in physical ability and whether self-care, like bathing or showering, is completed or not. That inability to express discomfort verbally or in words that you can understand can predict episodes of agitation. You might notice your parent fidgeting or making motions that appear to be distressful. That tells you that something is about to happen. A behavior is about to happen. Those behaviors can feel very uncomfortable and very threatening for you as the caregiver. Unexpected behaviors can be surprising because sometimes they come out of the blue, especially if you are new to this experience. Agitation is a cause of stress for caregivers and a safety concern for elderly parents. Behaviors increase when hands-on care starts. So you're trying to bathe your elderly parent and they're fighting you. These behaviors and the experience of hands-on care, the difficulty of hands-on care, are the top reasons that caregivers move elderly parents to communities, because they don't know how to manage these episodes, or they feel very uncomfortable, or sometimes, honestly, you may feel physically threatened. Behaviors can include agitation, anxiety, anger, yelling, verbal outbursts, physical aggression, repetitive questions or actions. Those are called perseveration. These behaviors can include wandering, refusals to participate in care, confusion, suspicions, and paranoia. One or several of these behaviors may be present in an elderly parent. Other elderly parents may not experience any of these, only confusion and memory loss, with really no frightening or aggressive behaviors. Not all people with memory loss exhibit behaviors. These behaviors, as we talked, they can result from frustration, the inability to communicate what your parent needs or wants. They can also result from responding to the behaviors of another person or environmental factors like too many people or too much noise. If you remember that example I gave about taking mom to the mall to go walking, and she saw the escalator and was just totally shocked by that and had an episode. The importance of a calm environment is significant for people with Alzheimer's and dementia. Inexperienced or uninvolved family members may not understand the importance of this type of environment. I've worked with families who had sons or daughters who were angry about being told not to visit a parent at a certain time of day or not to bring their 5 children along. Too many people or too much noise can result in overstimulation. Imagine this. Imagine having 5 people in your bedroom. Your son is talking to you. 2 children are playing games on iPads that are making annoying noises that you don't understand. How many of you have ever been on an airplane and you have kids playing on their iPods sitting next to you, and the noise is just driving you crazy, and you'd love to say something, but you don't? Another child in that room is crying because he or she is bored. They want to go home. You've got 2 more kids playing music in the background from their cell phones. Your elderly parent cannot take all of this noise and all of these things going on and all of these people in a single room. It's just too much. The brain of a person with memory loss can't differentiate or process noises, and as a result, they become agitated, angry, and upset. One activity, one person at a time is best. And if you want positive interactions, adjust your interactions to match the environment of an elderly parent. The interactions are no longer about what you want or about what you like or about when you want to visit. They are nothing about you. Interactions must be adjusted to the environment that offers comfort and calm for our elderly parents. I have had situations where children have waged lawsuits and legal battles over visitation. And most of the time, it is the brother or sister who has not taken the effort, who has not made the effort to become educated about Alzheimer's and dementia and the benefits of calm environment, how to approach and talk to elderly parents. They're just angry that they're being told not to visit, that they feel like they are losing control over seeing an elderly parent. And it's not that at all. They're thinking more about themselves than the environment and the life of an elderly parent. So if you are in one of these situations, take a step back, or tell your brother or sister to take a step back. Get some education, learn how to interact with mom or dad, and these squabbles will end. It's silly, in my opinion, to go to court and spend a lot of money to argue over something that a little bit of education and a little bit of knowledge can solve. Let's talk more about how daily routines lead to success. A daily routine, which means this happens at 8, this happens at 9, this happens at 10, is important to reduce behaviors and help complete daily activities. So things that are related, for example, cooking or food smells can indicate without even saying it that dinner time is near. Helping an elderly parent get into pajamas can signal that bedtime is near without even saying that it's time to go to bed. Playing soft music can indicate quiet time or time for a nap. When a routine is interrupted, behaviors can happen. Repetitive questions, anxious behavior, a need for attention or pacing are examples and signs that your elderly parent is ramping up and they're getting upset. In these circumstances, you can help by distracting them to help with an activity like folding towels, helping clean up the kitchen after a meal, just any activity. By being observant, by learning the personal preferences and habits of an elderly parent with dementia, you can arrive at the right balance of activity and rest and activity and rest. Creating a home or a care community environment that adapts to the person with dementia eases the stress for that person and for caregivers who are trying to complete daily activities and routines. Positive behavioral responses have these goals. You want to decrease the frequency of behaviors. You want to reduce the duration and the intensity of a behavior. And the goal of all this is to eliminate or reduce those behaviors and create a positive environment with pleasant behaviors. So how do we identify more causes of agitation? To avoid episodes of agitation, as a caregiver, you should watch for verbal or physical cues of discomfort. A verbal cue could be your parent talking and you not understanding what they're saying. It could be your parent yelling or mumbling. Physical cues are perceptive. So when I visited my clients, I could look at them and I knew right off if something wasn't right. But it was because I made an effort to get to know my clients' preferences and their regular behaviors, the usual expression that they had on their face, how they were acting if they were calm and not upset. If you are perceptive, you can become aware of the signs of concern that include. So unmet daily care needs or discomfort. I'm hungry, I'm tired. Depression or changes in mood. Maybe your parent doesn't want to interact with you at all. The effects of not being able to hear or see could be just agitation. Too much noise, too many people. Again, agitation. Fear could be noticed by your elderly parent following you around, wanting to touch you, wanting to be touched. Boredom can be indicated. I mean, do you remember when your children would get bored and they would act up? It's no different with an elderly parent. So just pacing, walking around, they're mumbling. Also, agitation can result in changes in a health condition. Dehydration, a urinary tract infection, constipation, maybe they're dehydrated. Also, medication side effects. Pain is another one. If your elderly parent is in pain, sometimes they might be moaning or they might not want to get out of bed or they might refuse to move because their body hurts, but they can't tell you. They may be anxious and really just want to be comforted. And then many times, and this is a big one, behaviors result from you trying to get your elderly parent to do something that they do not want to do. This is why if you have a daily routine, your parent has an idea of what happens. If you have a calendar and it says bath time at 10 o'clock or lunch at 12, your parent can have an idea of what's going to happen. One of my clients loved music and she loved to sing. So if ever we had to do anything that she did not like maybe change her clothes or her Depends, we got her an iPod with a headset. And we'd place the music on before we did anything. And we'd sing with her for a while. It would get her in a good mood. And then after that, we could change her clothes. We could change her Depends. We could just about do anything because she was in a good place listening to that music and we were singing along with her. Obviously, we tried to get whatever we had to get done as quickly as possible. But I also recommend these types of things. So music, anything pleasant to distract while you're doing something that your parent doesn't really want to do. Let's talk about train wrecks. These are situations where no matter what you do, your elderly parent is exhibiting behaviors of agitation, crying, anger, frustration, maybe physical actions towards you. I call these situations train wrecks. It's when it becomes nearly impossible to manage the behaviors through your interpersonal interactions, through environmental adjustments like music. At this point, if you have not already looked at medications, they may be the next step. If you have not yet consulted a geriatrician or a neurologist or a neuropsychologist, now may be the time to investigate medications for anxiety, behavior, depression, and memory loss, and do it before you get to the point where there is a train wreck. Very important is finding the right person to work with you. You will want to fully understand all of the risks of medications and the side effects so that you can watch for them. In my years of managing care for clients, I can tell you that doctors cautioned me and said, this can be a very bad medication or there can be very bad side effects. But I will tell you that the right medications can be the solution that returns your elderly parent to calm and stable behaviors and avoids you having to move them out of a house to a care community. There are very small variances, you must know, between too little and too much medication. It can take time to find the right combination. And when you have that combination that's working, my recommendation is really to resist attempts by anyone who wants to change that dose, unless there's really a good rationale and a plan to monitor the changes, and the person who's doing it is extremely, extremely experienced. I've worked with both. Medications for the elderly with behaviors and dementia, it is a specialty. Make sure that you find people who have extensive expertise in this area. If you don't live in a metropolitan area, you might have difficulty finding a provider. If you live anywhere and you are having difficulty, contact a teaching hospital. Find out if they have a geriatric program and if they have providers that see patients. If your parent was a veteran and can obtain any type of care through the VA system has great geriatric programs and great geriatric psychiatrists. Cannot recommend them highly enough. The other alternative is to find a local geriatrician or a local geriatric psychiatrist who can help you. On this subject, many family members will get so frustrated that the hospital emergency room becomes the place to take an elderly parent with behaviors. This is a warning. Taking an elderly parent to the hospital emergency room for behaviors is a danger zone. It may not work out like you expect. You're expecting the hospital emergency room to help you to solve your problem, and that many times is not what happens because they don't have the expertise in geriatric psychiatry unless they get you to somebody else or they have somebody on staff. So the treating physician at the hospital may put your elderly parent on Ativan or another short-term medication. It's a short-term solution. It's not a long-term solution. And I say that because they will place documentation in the chart of your elderly parent that will follow you everywhere, to hospitals, to skilled nursing communities, everywhere. And what they'll say is, daughter brought mom or dad to the hospital, mom or dad extremely agitated, daughter didn't know what to do, Ativan given, recommendations for follow-up with geriatric psychiatry. The danger zone means that your parents, because of these behaviors, may become known as a problem patient, and you could become known as a child who does not know how to manage the care of your elderly parents. In some areas, geriatric psychiatry wards do exist. And while it may be possible to have your elderly parent accepted for treatment, the best route really is to find an individual geriatric or psychiatric provider. That can take a lot of effort, a lot of time, a lot of phone calls. Your insurance may or may not pay for it. The healthcare system and insurance companies don't support acute care for people with dementia and mental health issues. That combination is very difficult. It's a subject that nobody's going to want to talk to you about. Practitioners don't even want to discuss it because honestly, they're embarrassed that we don't have good solutions. Many psychiatrists don't want to treat the elderly with behaviors. Insurance reimbursement is difficult. Behaviors of elderly parents who have dementia become a family issue. And there are situations where the only option for treatment may be to place your elderly parent in a nursing home that is versed in treating patients with behavioral problems. That may be a short-term way to address the behavior. It may be a long-term way to address the behavior. There are other challenges with that. There is a federal process called a PASSR, P-A-S-R-R, that is an evaluation system for people with mental health issues and dementia. And a PASSR is a process that ensures that nursing homes or communities don't take too many people diagnosed with behavioral problems. So your parent may get declined from communities, and you may not be told why. It may be because their PASSR population is too high. If you find yourself in these situations and it does become unmanageable, I have several recommendations. Find a physician's office who is willing to work with you, a geriatrician, a geriatric psychiatrist, a neuropsychologist, or hire a local care manager who has experience, because behaviors and medication management truly is a specialty. And I'll share a story. So in my 20 years, I have had many clients who arrived at a train wreck situation, not because people didn't try, because there was not enough support with medications, or because physicians believe that medications wouldn't help. I have had to work with the police and 911 and other people to get what is called an M1 hold. An M1 hold is a mental health hold, not necessarily related to dementia, but mental health, meaning that your elderly parent is a risk to themselves because of agitation, or a risk to others. So they're harming you, they're harming other people where they live. The situation is so bad that they must be taken out of their present situation and moved to a geriatric psychiatry ward if they exist. Now, the problem is your parent may get to that psych ward, and the psych ward may say, we don't treat elderly people who have dementia and mental illness. And they may send them right back to you or right back to the community. This happens mostly because communities don't have the resources to provide this type of care, which is why I recommend trying to avoid the train wreck and getting in with a geriatric physician, geriatric psychiatrist, neurologist, somebody who can help you long before these behaviors get worse. Do not wait. Because honestly, you don't want to be to the point where you are having to deal with M1 holds and psychiatry hospitals and all of that. It's very complicated. Most family members can't navigate it. I was able to navigate it because of my experience, but even I would get frustrated with providers who would say, you know, the mental health hospital is not going to keep them. As soon as they get there, they're going to send them back. You're going to have the problem right back on your hands. It's very difficult. I wish there were solutions. The solution is to be proactive early. Let's go to the next slide. So let's summarize this section. For caregivers, increasing levels of hands-on care. So you're trying to bathe a parent, they refuse. Trying to give them medications, they refuse. Having to change depends, they refuse. These incidents can place your safety and the safety of your elderly parent at risk if you're getting into physical struggles. In addition to these behaviors that we talked about. So hands-on care behaviors are the combination of events that do result in families considering placing an elderly parent in a care community. If you can work with medications early, you may never get to that point. But once it gets to the point of a train wreck, like I mentioned in the stories I've told, it can be very difficult to manage. Predictors of agitation can be noticed when daily routines are interrupted, when other factors come into the care situation. Those factors can be your brothers and your sisters without an understanding of memory loss who want mom and dad to be like they were, or who want mom and dad to pay attention to them. It's no longer about them, it's all about your parents. Other factors that spur agitation can be commotion in the home or being exposed to commotion outside of the home. Remember the mall walking incident. Learning to identify predictors of agitation by watching your parents very closely and to respond to reduce these behaviors is a learned skill. It very much takes trial and effort. So I thank you for being with me for this section on tips to reduce agitation. In the next section, we are going to talk about how to notice these behaviors, and there will be tips for how to respond to every type of behavior that you might be able to imagine. Stay with me. I'll see you in the next webinar.